The event is now formally launched.
Thank you very much. Thank you, Diana. A big thanks to the Geneva Environment Network for setting up this event, and to our partners from WHO, FAO, WOHA, and also the UN team in Europe and Central Asia. This event is in conjunction with the Regional Forum for Sustainable Development for this year, that is looking at 5 specific SDGs: SDG 1, SDG 2, SDG 13, SDG 16, and SDG 17. In that context, as a team, we have decided to organize this side event entitled Addressing the Interconnected Challenges of Poverty, Food Security, and Climate Change through a One Health approach. For some of the audiences who are not familiar with what a One Health approach is, this is basically an integrated approach. It's a unifying approach, looking at mobilizing multiple sectors, multiple disciplines, in order to work together, in particular to foster well-being and tackle threats to health and ecosystems. I know sometimes there's new definitions by the UN system that, like the sixth transition, may confuse people, but to unpack it, the 6 transitions are talking about food systems, energy transition, digital connectivity, social protection systems, education, and the triple crisis of climate, biodiversity, and pollution. More specifically, these are areas, as we move to the 2030 agenda in the next 6.5 years, if we could invest more in these areas as identified as catalysts and multipliers in terms of addressing the SDG progress in our region. So simply, they are about the SDGs, the 17 SDGs, but then how best can we accelerate the implementation by using the 6 transitions. So with that brief introduction, I also give the floor to my colleague, co-organizer, Svenja, to say a few things. Over to you, Svenja.
Thank you very much, Wondi, and everyone online. Good afternoon. My name is Svenja Hermann. I'm working for the WHO Regional Office for Europe, located in Copenhagen, and I'm very glad that we can have this meeting today. Just Wondi already explained and said that it's not always very easy, I think, for anyone outside the UN system to always follow up with the terminology. And I just wanted to say, bring another coordination mechanism here into perspective. I'm very glad that this meeting can be organized in the framework of the so-called issue-based coalition on health and well-being. This is a coordination mechanism that runs under the UN Regional Cooperation Platform at the regional level here in the UN for Europe, Central Europe, and Central Asia. That's a coordination mechanism that is led by WHO, but with the involvement of 13 different UN agencies, all looking and working together on health and well-being in the European region here. We've been working together under this mechanism for several years. We have a joint work plan. One of the areas is on One Health, for example, and this is now one of the deliverables for the region, really trying to show how different EU agencies work together to promote one of the main concepts that we find of importance for the region. So I'm really happy that we can bring, as the IBC on health and well-being, as a coordinated partnership mechanism to bring this topic forward to the audience today. So thank you very much. And I'm really looking forward to the different presentations and also the questions later on from the audience. Thank you.
Thank you, Sven. And I know one of our panelists has to go to the airport soon. That is Peter from WHO Europe. So I will start with Peter on a specific question linked to how does the One Health approach apply to food safety, and how can it help reduce food safety risks? Over to you, Peter.
Yeah, thank you, Wendy, and good afternoon, everyone. Pleasure to be here and to be part of this panel and the forum as it's unfolding over the week. So thank you for the question. And I'll narrow in and talk a bit about how the One Health approach applies to food safety. As you mentioned in the beginning, Wendy, One Health is an approach. So it's a way of working.
Yep.
It's not a technical issue or it's not a deliverable in itself. It's more a way of working to address health issues that originate in the animal-human interface. And food safety is one of those health challenges. So the One Health approach definitely applies to the way that we are managing food safety risks. We can take the next slide. Because I wanted just, first of all, to highlight what do we actually mean by food safety risks and what is the burden of foodborne diseases in the European region. These are figures that are a little outdated. There will be new estimates on the global burden and also the regional burden of foodborne diseases coming out next year. But this is the latest figures we have from 2015, showing that around 23 million people in the European region fall ill every year from unsafe food, and about 5,000 people die. If we then look at what are the food safety hazards, what is it that make people sick, basically? It's norovirus, it's Campylobacter, it's Salmonella, Toxoplasmosis, and Giardia, and so on. You have the list of hazards here. It's not, I don't want you to go into the details of what these hazards are, but I just wanted to emphasize that many of these food safety hazards originate in the animal population, and they're transmitted from animals either directly through the environment and into the food chain. And that's why it's important to have a multi-sectoral approach to the way we address food safety risks. The next slide, please. So this slide here and this little diagram shows the complexity of how food safety risk management is happening. So you have food safety risks in the middle, and then you have around it all these different steps of the food chain where food safety hazards may be present and where we need to manage food safety risks. So it's all the way from the farm to the consumer, starting with farming practices. They have a say in how safe the food is when it leaves the farm. Of course, there's post-harvest, there's processing, there's distribution, there's the retail or wholesale sector. There's the way the consumers behave when they prepare food in their homes, and how food is being prepared in the food service sector, so in restaurants, in fast food outlets, and street food, and so on. So all these different areas, you can say, is where the food safety risks appear and where they need to be managed. And of course, this has to do with the health of the animals that are providing at least food of animal origin, and then the environment, obviously. How safe is the environment? How polluted is the environment? That also has a say on how safe the food is at the end. And then we have the human health. So if we take the next slide. So the food safety risks is a shared responsibility across the entire food supply chain and with the different groups of stakeholders. It's both governments, it's businesses, and it's consumers. So if we look at the governments, first of all, the responsibility of government here, and this is not like a single entity or agency within the government, this is across the different ministries and agencies of government that are involved in the official food control. So it's the responsibility of government to develop contemporary food safety policy, legislation, and to verify that it's being followed by the food businesses, whether it's distribution businesses, retailers, or restaurants, or processing, manufacturing businesses. Doesn't matter. They're responsible for verifying that all of them comply with the food safety laws and regulations and standards that are in place. Now, if we then look at the businesses, that's the very broad spectrum of food producers, transport companies, retailers, food service providers, and many others that are typically private businesses producing the food. They hold the overall responsibility and the main responsibility for making sure that the food products they put on the market comply with the food laws and regulations and that it is safe to be consumed. So they manage the food safety risks across the entire food supply chain. But of course, the consumers at the end also has an impact on how safe the food is. Even if they purchase safe food from the supermarket or in the restaurants, if they contaminate it at the kitchen table or at the moment of consuming, that has an impact, obviously. So they need to adhere to good food hygiene practices and safe food handling practices at their level. Next slide. So with this complexity of managing food safety risks, it's very clear that the food safety as a health challenge requires a One Health approach. It needs a coordination, it needs collaboration across the different groups of stakeholders, and good communication, again, through the whole food supply chain. Next slide. So as a quadripartite, so when I say quadripartite, it means 4 organizations working together to promote and to operationalize the One Health approach to address not only food safety risks, but all health risks that originate in the animal, human, and environment interface. So it's WHO, it's FAO, who's also present, and WOHA, who are also present here at the webinar today, and UNEP, obviously, with Wendy. We work together as a quadripartite alliance, and we have issued or launched a joint plan of action that shows on how we're going to work together to help countries also address the health risks that originate in the animal-human interface, and how we are going to support the operationalization of the One Health approach. If we take the next, I just wanted here to emphasize that food safety is an action track. It's action track 4, where we focus on strengthening the assessment, management, and communication of food safety risks. Next slide. So under this action track, there are 3 specific actions that we are working on to help countries, and that is to strengthen the One Health approach in the national food control systems and in food safety coordination. It's about utilizing and improving food systems data and analysis, the whole scientific evidence and the risk assessment for countries to develop and making integrated food safety risk management decisions. And then it's about fostering the adoption of the One Health approach in national foodborne disease surveillance systems and in research. So we know what is the burden, first of all, but also what is the source attribution. So we know what is it that's making people sick in terms of food safety hazards, but if we can even narrow into specific food products, even better. But that is only possible if we work across sectors and across different groups of stakeholders, and sometimes even across national borders. Linked to the joint plan of action, last year, the quadripartite, so the 4 organizations, issued and launched this guide on implementing the One Health joint plan of action at national level. So this is guidance specifically for countries and showing them how they can work through what we call 3 pathways in operationalizing the One Health approach. So the first pathway is about governance and policies and legislation, which goes across various different topics and technical areas. It's about the organizational and the institutional development, implementation, and the sectoral integration. And it's about the data and the evidence and the information systems that are needed for knowledge exchange across, again, countries, sectors, and stakeholders. And then my final slide, just to re-emphasize that adopting the One Health approach and very extensive collaboration and coordination across sectors, stakeholders, and countries is absolutely necessary to reduce food safety risks. So with that, I had limited time available. I'll give it back to you, Wendy, and happy to take any questions there might be from the audience.
You're muted.
Thank you very much, Peter. I was muted. Yeah, I'll repeat what I said. Thank you. That was very, very useful. And also in terms of to our audiences who are listening to this, to make that link to the SDGs that are under review this year in terms of, what does this mean? And the food system transformation in terms of its impact on poverty, its impact on climate change, its impact on partnership and means of implementation. So as you have seen from the presentation, there is a major link, especially using the the One Health approach, this approach that is about an integrated response to a specific problem, it can be used in other areas. I think that is one of the big messages, and we urge you to look also the One Health Joint Plan of Action. We have already posted it in the chat. Those of you who want to look at it in details, you can have a look at. So thank you very much, Peter. I know you have to go, but in half an hour or so. But if there's any question, we will take care of it, or if we cannot, we will also direct it to you. And now I pass the floor to my co-moderator, Sven. Over to you.
Thank you, Wendy, and also thank you very much, Peter, for taking the time. And it is now my pleasure to hand over to the next panelist, Julio Pinto, from the Food and Agriculture Organization. And my question to you, now we've seen how the One Health approach can be applied specifically to food safety. But Julio, to you, how does the One Health approach ensure coherence in policies or across policies? The floor is yours.
Thank you, Svenja. Can you hear me? Perfect, thank you. Thank you for the invitation and to Wendy and the organizers for inviting FAO and to these very, very important discussions on the One Health approach and how the One Health approach is used to shape or to enhance governance and policy, in particular at the country level, on the good coordination among different sectors. Just to say that the concept of One Health in FAO it's very important because it's an approach, as Peter say, it's an approach that can be used to improve the connection and the coordination among different sectors and to address very complex issues, including health, but also agri-food system transformation, climate change, and others important processes. That I think One Health, we should not see One Health only from the health perspective. It's also an approach that can be used also to address some issues related to development and development of systems, and how to address some issues related to poverty, to food security, and to climate change. Then the approach that FAO is using internally in our strategic framework is to, for the first time, to have a One Health as one of the programmatic priority areas, and we have an interdepartmental or colleagues coming from different technical divisions in FAO, which is a food and agriculture organization of the United Nations, in which we have also internally different type of expertise. We have different technical teams working on climate change, agri-food system, food safety, animal health, land and water resources, fisheries, forestry management, etc. Then it's very important to highlight that the One Health approach in agri-food system is to really help to improve productivity and to enhance food security. And this is using the resources available and also to make sure that we are not degrading soil or land resources or animal resources. And we have a very good balance between the needs of increased production to feed an increased human population and also to maintain the ecosystem and to make sure that we are not degrading the natural resources. But we know that we are facing today issues related to some threats that are emerging at the animal-human ecosystem interface, in particular health threats, pathogens, antimicrobial resistance, and others. And we need to use, we need to try to encourage local systems, communities, and local authorities to use the One Health approach to really enhance their collaboration and also to make more efficient the use of limited resources, in particular in developing countries. Just to give you some examples of how FAO is looking the inclusion of the One Health in agri-food system transformation. For instance, FAO is promoting the sustainable livestock transformation and One Health. And for this, FAO is last year we organized for the first time a global conference on sustainable livestock transformation, and we have very important outcomes of that conference, in which we have been developing some specific publications that can provide some recommendations to countries how they can also formulate their policies for this important process, which is make the sustainable the livestock production more sustainable, in particular in developing countries. One very important report that FAO produced last year was launched last year was the pathway toward lower livestock emissions from the livestock sector. Also, another very important publication that FAO produced was the FAO's work on animal production and climate livestock solution in animal health and including One Health. This is very, very important because after this conference, there were, and I would like to share with you, 3 main recommendations from this global conference. One is that we need to make sure that the livestock sector is sustainable and sustainable for food security, sustainable for nutrition, and also sustainable for inclusive economic growth. The livestock sector is related to climate change is part of the problem, but at the same time, we think that is part of the solution. We need to make sure that with increased demand for animal source food by an increased human population, this demand will increase by 100% in low and middle income countries by 2050. Then we need to make sure that we produce food, but at the same time we sustain the production and we sustain the environment and natural resources, including water. Then it's quite relevant that we can use and after this conference that FAO organized last year, FAO also is promoting some mitigating solutions for the livestock sectors, in particular on the greenhouse gas emissions that the livestock sector is producing, which represent around 12% of the total anthropogenic greenhouse gas emission. But how we can mitigate these livestock these greenhouse gas emissions coming from the livestock sector? We have some solutions. We have some good practices. We have to promote selective breedings in animal population. We need to also change some feeding strategies in the livestock sectors. We need to also make increase in productivity, change also in consumption partners, reducing food and feed loss and waste, improving animal health and welfare. And also we have to make sure that we increase the carbon sequestration, in particular in grasslands. These are some of the mitigation solutions that the livestock sector can promote and can encourage in different regions and countries to move through this agenda on sustainable livestock contribution, in particular considering the needs for a population that will demand more and more animal source food, in particular animal protein. Then the One Health approach, we think that is a multi-sectorial and multi-stakeholder coordination approach that can address these issues, in particular at the interface between animal, humans, and environment, and also to address some of the drivers of disease emergence, in particular poverty, climate change, agriculture intensification, land and soil degradation, deforestation, and biodiversity loss. We think that we need to work at the upstream prevention. We need to address these drivers because this is the only way that we have to really anticipate the impact and the consequences of outbreaks of zoonotic diseases, but also pandemic issues or potential pandemics in the future. This approach needs to be tailored to the needs and policies that need to be formulated at the country level. I think this is the most challenging part because we need to have a national coordination of One Health at the local level, at the community-based level. And I think this is something that the quadripartite and other organizations at national level are working, in particular with the with the participation of non-governmental organizations, NGOs, the local organization, etc. We need to make sure that this approach is taken from the basis, is taken from the local level, and we have to make sure that there is a right coordination and governance at the local level, in particular the responsibilities and the commitment of different sectors, including the food safety sector, the animal health sector, the environmental sector, and also the human and public health sector. Then, just to conclude this part of the question, we need to make sure that One Health is really embedded in the local policies, in the national policies of governments, and to have a more sustainable implementation of the One Health approach, in particular in developing countries, because we think that the One Health approach can benefit in particular the developing countries because they have more limitations in terms of capacities and also in terms of human resources. And I think having this approach in place, it will benefit, in particular, the local communities and the national institutions.
Thank you very much, Julio, for the very rich presentation and also highlighting the intersectoral nature. You mentioned many different sectors, and also the emphasis of the importance of engaging, well, the implementation at country level, first of all, having the right policies and institutions and governance mechanisms in place, but also specifically to work with the communities and set up a light governance mechanism there as well. And yeah, thank you. And without much further ado, I will hand over to Wandy to introduce the next panelist.
Thank you very much. And maybe one thing I can flag also in the context of this specific topic is there will be a dedicated peer learning session on SDG 2, which is also looking at nutrition, diet, food security, as well as climate resilient agriculture. So I think I would urge our audiences to log on 14th. It is in the morning from 10 to 1 o'clock. Also to learn a little bit about what is being done in the European region in terms of advancing SDG 2 on food. Having said that, we also have a pleasure of having Dr. Gabor from Hungary. And the question I really wanted to ask is, Hungary was a host of this amazing conference we have had not long ago. It's the interministerial conference that brought together ministers of health and ministers of environment. For the first time, we really talked about how do we use the health lens in terms of addressing the triple planetary crisis, including other issues like AMR. So one of the things we really wanted to hear from you is a little bit of an experience from Hungary, and if you could share that with us, how that can also fit into this discussion we have on the sixth transition. Over to you, Dr. Gabor.
Thank you. Thank you very much for inviting me and to give opportunity to talk about these very important issues. I'm listening to the former two presenters. I realized that I'm always fascinated with the versatility of the One Health approach. So how comprehensive it is and how overarching it is. But please let me concentrate more on my trade. I'm a microbiologist, so I would concentrate rather on those issues which are connected to that, and we'll have a lot. This conference, what was mentioned in last year, was concerned with environment and health, as you all know. And environment and health is very deeply connected to the One Health concept, especially if we consider the triple challenge: the climate change, the pollution, and the biodiversity loss. And we will find all of these very closely related to the issues I'm intending to talk about. And this conference had the intention to tackle all these challenges and to give or propose answers with which the challenges can be met. So if we consider climate change, which is now quite on our skins felt, then climate change is not just a question what humans will experience in terms of changing weather, in terms of catastrophes, or in terms of food safety, but also is an issue from the side of the infectious diseases. So to me, climate change is primarily to learn and to prepare new infectious challenges, which will, through climate change, reach regions where we would not expect them at all. And also these emerging infections and non-infectious causes for health will lead to and be interconnected to a lot of other challenges in a One Health context. If we just consider that the climate change will inevitably change our food production and food safety, and we might face the challenge whether shall we give up quality for quantity, and also in that regard, what can we do with the sustainable food production and at the same time avoiding various infectious and non-infectious challenges. What I'm thinking about, for example, if we want to make a sustainable animal production, then there's a conflict between whether we wish to produce animals cheaply, sustainably, and at the same time we would like to have them producing very safe and ample and nutritious food. So this is a big challenge when we need to find the solution for the animals to be produced sustainably, and at the same time to keep very strong food safety issues, which was just tackled previously by the two former speakers. Another point with climate change is I'm thinking about that there is skepticism about that, and this skepticism should be overcome with increasing climate literacy and education. And why I'm thinking it that microbiologists face the same challenge with the infectious diseases, that if we do not increase health literacy of people, then we face a bigger challenge than the diseases themselves to convince people for countermeasures and to get our countermeasures accepted. So I think that climate change teaches not only those things which I mentioned, but also that education and awareness increase is extremely important to tackle these triple challenges. If I now move on to environmental pollution, then environmental pollution with a lot of problems arising, like air pollution, wastewater, and other things. I would concentrate now on my trade again, on AMR and its links to AMR. Antimicrobial resistance in itself may be viewed as a consequence of pollution. As when we take the antibiotics or apply the antibiotics during food production, let it be animals or crops, then these antibiotics are frequently viewed by people that they are lost somehow. They are used up and disappear, but that's not true. The antibiotics we take or we use in agriculture are remaining with us and reach the environment. And also during production of these antibiotics, we will experience that they escape the production route and they act as pollutants. I was just giving lectures to students in the morning with the similar topics. And I remember now a very striking data point that 31 milligrams per liter of ciprofloxacin can sometimes be measured in certain natural waters, which is the therapeutic concentration or close to the therapeutic concentration. So pollution with antibiotics is a very important issue, just as declared in the Budapest Declaration. And these polluting antibiotics reaching the environment will have effect there. What we are sure that they will have an effect. What we are just starting to recognize what kind of action they might exert there. So we know that we release tons of antibiotics to the environment, together with heavy metals and disinfectants, which might act very similarly in terms of altering the microbial communities. So we don't know what happens when we do this. We have some ideas, but definitely there is a huge amount of research work to be done and a huge amount of awareness increase work to get these upcoming results to decision makers and to the general public, as well as to professionals, and to link professionals with the information to understand how complex this issue is. So when we release antibiotics, heavy metals and disinfectants, and this will push a selection pressure on the bacteria in the environment, resulting in antimicrobial resistance developing. And at the same time, we release antimicrobial resistant bacteria from crop production, from human medicine and from veterinary medicine, like various animal premises responsible for food production. So these antimicrobial resistance reaches the environment, and it does not remain there. Antimicrobial resistance will get back to us through the food chain, through our drinking water, through the various recreational activities. Just imagine that what we release with either the wastewater or any other way, this is just picked up by various animals, a wealth of animals which are residing in our environment. And some of them are even capable of long distance traveling, like the migratory birds. Imagine that terns nesting in Europe may easily reach South Africa or even tip of South America and Antarctica in a few weeks, carrying the antimicrobial resistant strains what they might pick up in Europe to there, or pick up antimicrobial resistant strains there and bring them back to Europe. So there's a very huge interconnectivity in this antimicrobial resistance problem and issue. And at the same time, antimicrobial resistance is not just something which threatens humans. It also threatens sustainable food production. Antimicrobial resistance can be an issue in crop production, but is definitely an issue in production animals. And when animal production is made sustainable, and we try to optimize it to be as sustainable as it could be and as profitable and sustainable in this way as it could be, we now heavily rely on antibiotics and antimicrobial agents. But these antimicrobial agents will then cause resistance. So this is an inherent conflict which needs to be resolved somehow with a concerted action. And for this, definitely we need to an overarching approach, not just professionals talking about that, but also decision makers, and very importantly, the general public, connecting to education and connecting to digital development, because we need to spread this information as broadly as possible and collect all the ideas from as broad audience as possible, and try to put it as co-creative as possible, because primarily what we do in AMR as professionals, microbiologists, doctors, veterinarians, environmentalists, whatever, will all rely on the people who will use our results in their daily life. If we can convince them that they should be prudent in their antibiotic use, they should be prudent in choosing their food, and all the issues which were covered earlier or mentioned in the Budapest Declaration, then we are much closer to success if we need to enforce laws or enforce any kind of regulations. Another point which I wish to tackle and or put to the floor, that what we do not understand in terms of AMR is environmental microbial diversity. So what we know that released antimicrobials and antimicrobial resistance organism will change the microbial communities in the environment. The problem or the issue is that we don't even understand perfectly the healthy microbial diversities in the environment. So not even the antibiotic pressure, before the antibiotic pressure, we don't understand what happens to them. So that's again a point which will determine our upcoming years if we wish to make a sustainable society with food safety and fighting poverty and all the issues which are the topic of this webinar, as the biodiversity loss, and with this I would then link to my third chosen topic, that biodiversity loss will have also issues, not only the crops, but also on the disease evolution. Just let me remember everyone for the COVID pandemic, which is now hopefully on its ebb and not in its high tide, that it came with many other examples from the animal environment, from the wild animals. These wild animals are subject to our influence in terms of pollution, in terms of antibiotics, antibiotic resistance, in terms of habitat loss, and in terms of utilizing them for various purposes.
I give one more minute.
Thank you.
Yeah.
Which creates this creates a very peculiar situation, that what we are doing currently is that is we create our next enemies with tackling with the evolution involuntarily and without understanding what we are doing. So in conclusion, I would say that the triple challenge would be met also not only from those points which were covered, but we also need to be microbiologically sustainable as to fight infectious diseases which threaten our health and our food supply, as well as biodiversity. Thank you very much for listening.
Thank you very much, Dr. Gabor. That's very exhaustive. I would not add anything to it, but I'm sure we get your speaking notes if others wants to know in detail what this the outcome of the Budapest conference. You've covered it well, and with that, I pass on to my co-facilitator, to Svanja, for the next session. Over to you. Thank you very much, Dr. Gabor.
Thank you.
Yeah, thank you very much also from me, Dr. Gabor, and thank you, Wondi. Being mindful of the time, I would like to move to our next panelist, Dr. Chadia Vanous from the World Organization for Animal Health. And the question that we would like to ask you specifically is, what challenges or what challenge do you foresee in integrating social perspectives into One Health policies and programs? And how can we address those challenges? And you may also want to just say a few words on your organization's vision on the next few years for this approach as well, and just being mindful of the time. Thank you so much as well.
Thank you very much. It's hard to be the last speaker, so
Yes,
I will be brief. Thank you. Thank you for having us at this important webinar. I would like to start by saying that we know, all of us, that we have a lot of social and environmental factors that accelerate the emergence and spread of pathogens among and between human, animal, and the environment. And these factors include insufficient access to health services, being in the human health or the animal health. We know that also the intensive production of livestock may create drivers of risk if it's not done in the right way. We know that we have challenges in lack of access to water, to sanitation, to waste management, and to hygiene. And we know that also on top of this, we have insufficient regulatory frameworks and lack of awareness and education on the One Health approach or in the appropriate use of our natural resources. All of this put us at risk of threats that can happen at the interface between animal, human, and the environment. To prevent this, to detect it early, to respond to it, and to mitigate its impact, we need to have a coordinated approach, and we need all of the sectors and the disciplines to come together and provide their strength and their expertise. And for that, the One Health approach will provide us with the means to do this. An important issue to highlight that this One Health approach look at the systems. It doesn't look at the threats or the disease or one issue and not the others, but it look at the system approach to support the health of all, human, animal, and the environment, and identify the drivers, the factors that make us more vulnerable or susceptible to diseases. So by integrating this environmental dimension and social dimension into our consideration of how to address the threats, we gain a broader understanding of the disease, and we know for sure how to respond to it better and how to prevent it at the source and prevent it from happening in the first place. I want to highlight a few issues that we deal with in this area of work. As an intergovernmental organization, the Quadripartite Collaboration for Animal Health, which is FAO, UNEP, WOHA, and WHO, our mandate is to provide technical support and capacity development to our members, especially to those that need most of this because of lack of capacity, of lack of resources. And for that, we do a lot of training and learning, including e-learning that was flourished during the COVID-19 pandemic. One of the issues that we need to do now is to bring all these learning platform or academies or virtual centers together. And for that, WOHA, as the quadripartite secretariat chair for this year, we put it as one of our strategic priority is to link those training centers from the four organizations and provide our health professionals and policymakers with one windows of learning that we can all go to and look at the different perspectives and try to integrate the perspective from the social scientist, from the political science, and also from the biologist and virologist and ecologist, of course, into this. The other one, it's to ensure that we provide the evidence for all of our One Health interventions. And for that, we need also evidence on the importance of social science or social environment, and the gender aspect of our threats, and how to deal with it, how to improve it, and how to do impact assessment of One Health intervention that to provide this evidence to policymaker so we can target better our investment and our strategies. In terms of investment, a lot of talk were about how to show the business case or the economic case for One Health. And for that, the quadripartite collaboration, we came together and established a community of practice on return on investment, where we encourage the countries and our partners to share with us case studies and best practices on how the One Health approach was used on the ground and what was the return on this investment. This body of evidence will help us to advocate for more support to One Health at the political level, but also for more investment in One Health, especially at country level. And the last point I would like to share, it's about the data. It's one of the pathways of change that we advocate for in the One Health Joint Plan of Action. The first one is about governance, and we talk about it a lot in this webinar. And it's very important in terms of regulation and coordination mechanism that need to be in place to allow this sectors and discipline to come together. But to generate the data, the knowledge and the evidence, it's very important to also have the mechanism to share it. And for that, we know that reporting by countries of health threats and the interface is important. And we encourage more and more transparency and more sharing of data and expertise on how to deal with these challenges. And I would like to give an example from a recent project that we try to integrate the environmental data into the early warning system for vector-borne diseases. And WUHA has initiated this project in 6 countries in North Africa with the support from our partners and collaborating center to strengthen the use of remote sensing and environmental and Earth observation data through productive model, innovative models to improve risk-based surveillance for vector-borne diseases. And we would like to see more and more of this collaboration between the sectors at country level happening. At the end, I would like to end by saying that One Health, as we said, it's not new. We have been working on the One Health approach at least since the 2000, but it gained momentum and recognition because of the COVID pandemic, where we clearly demonstrated that we cannot tackle those threats alone. We have to work together. And we need the mechanism that can allow us to do this, and the investment and the advocacy and buy-in from our politicians and policymakers to ensure One Health is implemented at all levels. Thank you so much. Over to you.
Thank you so much for the very, very clear and concise points of coordination, governance, capacity building, the importance of the evidence and the data, and also lastly, of course, the high-level commitment that is necessary to, after so many years of this topic being around. And Wondi, just to give the floor back to you, we're almost at the end of the hour.
We only have 3 minutes. but it would be a missed opportunity if I don't ask Shadia. The WOHA is going to take over the chairmanship of the One Health, the quadripartite. So if maybe in 1 minute, if you could say what is the vision, what is that you want to promote with this the 2024-2025 chairship. And the last but not least, you talked in this conversation, I heard a lot about education training, a lot of it. And what is interesting is the joint plan of action. I think if there is one thing that is all over the place is actually training, education. But how do we turn it into reality? What is that we can do to raise awareness, not just put it in the JPA, but also actively working with UN country teams and partners? How do we raise this issue, not whenever there's a pandemic, but in the normal days, in the day-to-day activities of ours? So over to you.
Thank you so much, Wendy. In terms of our priorities, we identified 5 of them that we would like to work with our partners. The first one is to implement the One Health Joint Plan of Action at country level. And for that, we need to do joint resource mobilization to ensure that we have the finance and the funding that can support the countries to implement the One Health approach. The second one, we recognize that we have the regional coordination mechanisms, and these are very important for us because they are closer to the countries, and also we can tap into the regional partners that are important for the work. The third one, it's about the One Health tools and resources. As you said, we have many of them, but how to use them efficiently and effectively, how to make them accessible and usable to countries. This will be one of our priorities. And also about the communication of the One Health activities. We do a lot of activities, we do a lot of interventions and projects, but do we communicate them well? I think there is a room for improvement here and to target our messages to the different audience, be it the policymakers or the funders or the youth who are very interested in doing a lot of work on the One Health approach. Our second priority is to have a sort of monitoring and evaluation of our work to be able to have few high-level indicators that we can show where we are progressing and to improve the case for the One Health. The third priority, I mentioned it in my talk, it's about the learning and how to link all those learnings from the different organizations and provide one-stop shop for all the One Health learning and tools and competency framework to facilitate their use. And also to avoid duplication where we know what exists there. And the last priority, it's about keeping the One Health high on the political agenda. One of the venue is the current negotiation of the pandemic agreement currently going on, and how to ensure that the One Health approach is recognized as a principle for this agreement. Because without it, we will not be able to prevent or prepare or respond to any future pandemics or outbreaks. And of course, our engagement with the political forum like the G7, the G20, the Peace Forum, and others. And the final one is to support One Health interventions or actions and to show the case for One Health and its impact. And we talked about working more about vector-borne diseases, integrating the environment, animal health, and the human health together in this venture. Thank you so much, Wendy.
No, thank you. Thank you very much. This is very, very useful. I know maybe Spania want to say a little bit about the IBC work. It is one of the things we wanted to do is actually use this kind of knowledge, body of knowledge that exists, also to reach out to our UN country teams, and the resident coordinators can actually be our champions. So we thank you for today, but we will call upon you in the future, because we do want to organize this kind of awareness raising activities with the countries. Maybe Svanja, over to you. I think from my side, it covers it, and I know we've gone by 2 minutes. I don't think we'll have a Q&A session, but we keep everybody informed about this. Yeah, over to you, Svanja. And you can close it.
Thanks so much, Wendy. Yeah, as you mentioned, the IBC Health, one of our big mandates is to support UN country teams and UN resident coordinators. Specifically, I like the point about the messaging and targeting main messages to audiences, is so to support the UN country teams in awareness raising of that concept at the high political level, but also at the community level. So we've been doing some webinars already, and we will continue doing so. And I also noted with pleasure that there will be a focus on bringing all the learning information together. So maybe this is also something that we can tap into as IBC Health to give that to also the UN country teams. And I think the biggest issue that I would want to bring up is the audience, maybe perhaps you know, the UN as a family has country plans it develops with countries where there are UN country teams. Many of these plans are being renewed at the moment, and we would also like to promote and encourage the UN country teams to include One Health in those UN country plans, because this is really the place for the intersectoral work. And there's also a guidance note on that has been developed by colleagues at the global level, also with input. Wendy, you've also been working on that. And there is a specific guidance note for UN country teams and resident coordinators on the One Health concept and how to integrate that, which may also be interesting to the audience here to use this. So thank you very much. I think there's a lot of things we can pick up for our work as well. And thank you to all the panelists.
Thank you.
Thank you very much.
So
wishing you a nice day. Thank you.
Yeah, we stay in touch, but thank you so much for a very, very useful and engaging session. Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye-bye.